Good morning and welcome to day 2 of the 2011 FormFast user group meeting. I'm Aaron Voss, Director of Marketing, and I'll be hosting again today. Thank you to those who attended yesterday's sessions. I'm glad we got a chance to share some of the new products, features, and resources we've developed for you and hope that you found it valuable as well. Also, thanks for coming back to day 2. And for those joining us for the first time today, welcome. In today's session, we have a lot of education and great conversation planned, but before we get into it, I'd like to review a few housekeeping items. Note that the sound for the session today will be audible through your computer speakers. If you're having problems hearing the audio, contact me, the host, in the chat window. We'll approve you to join the teleconference, which you can be joined by going to the top of the screen and clicking Communicate Join Teleconference. Once connected to the teleconference, please mute your computer speakers to avoid hearing a feedback echo. Feel free to direct questions to the Q&A panel and comments to the chat window on the right side of the screen throughout the event. If we're in the middle of a presentation, we'll save those questions until the presentation is completed and then present those questions to the presenter. Now let's review the agenda for today's event. To start the meeting, we'll be hearing from 3 members of Phelps County Regional, a premier Meditech hospital. And then following their presentation, we'll be hosting a FormFast user forum panel discussion. In that session, we'll be joined by Dina Daniel from Health Central, Caroline Cyrus from Centra, Jennifer Barron from St. Mary's, and Eric Ballard from here at FormFast. They'll be sharing their thoughts on ways to improve FormFast adoption and implementation, lessons learned, and other thoughts on the healthcare industry as a whole. Next, we have one change to our agenda. Our scheduled speaker, Kim Kaur from Chatham-Kent Hospital, had a family emergency come up, so she won't be joining us today. However, Jordan Miller, a workflow specialist here at FormFast, was kind enough to take her place. Jordan was a featured speaker at the Muse conference this past May, giving an educational presentation about the need for workflow in healthcare, and he'll share part of that with you today. Finally, we'll be featuring another round of virtual breakout sessions at 1 Central Time. For those of you who missed yesterday's meeting, after the conclusion of the main session, a selection screen will appear allowing you to choose a breakout session to attend. Today we have 4 educational sessions to choose from centered around our products. The first is for Form Designer, our form design tool allowing you to convert paper documents and PDFs, other formats into our proprietary format. The second is for FastPrint, Form Imprint, and Web Form Imprint, and eSignature, basically our output automation solutions. For our Meditech Magic users, we have a session about our Form Central product designed specifically for you. That is the Meditech Magic version of our output management solution. And finally, for our FastFlow customers, there's a session dedicated to our workflow platform to go through some of those tools. On each session, there will be a FormFast consultant providing tips and tricks, best practices, advice about organizing processes, and more. They'll give a short presentation, but we wanted to give you plenty of time to ask questions as well. So feel free to ask specifics about the products. We're also doing another drawing for an iPad mini today. Yesterday's winner was Beth Kay from Mid-Michigan Health. So Beth will be sending you your prize. Stick around to see if you win today's iPad. We'll announce the winner before the virtual breakout session. Just a few other things to note. First, if you aren't receiving updates about FormFast products and events, we encourage you to sign up for our mailing list. This only takes a couple of seconds. Simply visit formfast.com/contact and click the Join the FormFast mailing list icon. Second, to request a product update, please visit the brand new FormFast user group site at formfast.com/usergroup. Once you've registered, you can access the update section to see the latest versions of each of the products and request an update download, given that you have purchased that product. In addition to this, there are great resources like training videos, documentation, and discussion forums where you can interact with other FormFast users. And now, without further ado, I'd like to start today's meeting with an automation case study featuring a team from Phelps County Regional Medical Center in Rolla, Missouri. Phelps County Regional is a distinguished healthcare organization, particularly in the Meditech space. They're noted as one of the select population that has achieved stage 6 of the EMR adoption model. Today we're joined by Melissa Blanton, Sharon Clayton, and Jessica Sansucci to tell us about their path to improved automation. And Melissa, Sharon, and Jessica, welcome.
Thank you.
I'm just going to make you the presenter here, and then the floor is yours.
Okay. Well, this is Sharon. I'm going to start off kind of giving us an overview, and I'll introduce everyone. As Aaron has already said, we've got Melissa, myself, and Jessica here. Melissa's our HIM forms coordinator. What her role is in the organization is basically what it sounds like. She's coordinator of all our forms, clinical forms. She's going to be helping with our FastFlow product when we implement that. She builds our forms currently, and she's kind of my driving force for compliance and making sure the form approval process is followed. Then myself, Director of Health Information, that's kind of self-explanatory. And then Jessica is our HIM Informatics Analyst. In our organization, we have super users that are within the department that are experts on our system that affect our department. So she's our super user in HIM. So I'm going to start off with just giving an overview of our hospital. We're located in Rolla, Missouri. For those who don't know where that's at, we're south central Missouri, kind of in between Springfield and St. Louis. We're licensed 248-bed hospital. We have reached HIM Stage 6 EHR recognition, and we have also successfully attested to meaningful use Stage 1. The basic systems we have at our facility, our HIS system is Meditech Magic. We're on 564 Priority Pack 19. We're going to be upgrading that here at the end of August, first part of September, so we'll be going through that. Our scanning and archive vendor, our current system is Valco. However, we're in process of implementing Perceptive's product ImageNow. Some of our 2013 goals that we're utilizing FormFast products for is we're actively working towards reaching the Stage 7 recognition. That's a goal we've had in place, but we've had to wait for other things to happen to get there. We think this year we may be able to reach that. We're hoping to attest to meaningful use Stage 2 by October 1st. We have a scheduled go live of Perceptive now for August 27th. And then we're hoping we've started implementation but have not completed it on the next two, the FastFlow workflow automation software and the implementation of the web form imprint.
Under FormFast Form Designer, it's designed to help users create and maintain forms for use with the healthcare setting in conjunction with logic-based admission printing and on-demand printing. The forms can be created from scratch, or existing forms can be imported in a format that allows for modification and updates. We import or build your form in a standard template that is built to your chosen format. While using FormFast Form Designer, form ID barcodes are placed on the forms. Forms can be printed with patient medical record number and account number barcodes on them or without. Completed forms are uploaded to Forms Central in Meditech, allowing the end user to access and print forms through Meditech. Before the FormFast Form Designer, it was a real mess. We spent a lot of money on pre-printed forms, and the forms were not standardized. The floors would have drawers of forms, and multiple versions of forms were being used. Form Designer implementation. We started barcoding and building forms in 2001, and currently we have about 1,100 active forms. We created a forms committee and developed form guidelines and policy for forms that are part of the patient's medical record, and we implemented approval processes to help ensure forms are compliant with Joint Commission and CMS regulations.
And then just to talk a little bit about where we are now after having the form designer in place for several years. It was mentioned earlier in terms of the barcoded forms that are scanned into our medical record. We're currently using Valco as our scanning and archiving vendor. And Valco has the ability to read the barcodes from Form Designer, and it will identify the form name. However, it still requires end-user interaction. They still have to verify that that form is named correctly in the Valco system. But as we move forward with ImageNow, it also has the capability of reading that barcode and naming the form. But as long as a recognizable FormFast barcode has been used, then that software will automatically index that form to the patient chart without any end-user interaction. So this is really going to help us with meeting that goal that Sharon mentioned earlier about meeting HIM Stage 7, because it will decrease the time from scanning to the point when the form is actually viewable for patient care and hospital operations. And our top challenges that we face really could be boiled down just to end-user compliance. Some of the main challenges we've faced over the years are users not using clean copies of forms so that the barcode's readable, not printing the form with patient information whenever possible, putting forms through the approval process so that they could be barcoded in the first place, and then copying forms and, as Melissa mentioned, sticking them in a drawer or file folder for ease of access, but in doing so, they end up not being the most recent version of the form. And then also just writing too closely or through the barcode so that they wouldn't read. Some of the benefits that we've seen, though, from using Form Designer has definitely been in terms of cost control. So we've seen a decrease in paper and toner costs as well as waste, and we've seen improvement from our end users in compliance of using the correct version of the form, as well as control over the forms that are actually being used throughout the facility. One of the biggest benefits is helping to streamline our indexing process, which enables decentralized scanning. So just in case you're not familiar with what that process is, here at our facility previously we were collecting a full patient chart on a daily basis once the patient was discharged, and then scanning and indexing that whole patient chart here in the medical records department. But thanks to having these barcoded forms with Form Designer, we have the ability to start scanning directly from each floor or department while the patient's still admitted, and that lets us get the documents into the electronic medical record more quickly and more efficiently. And looking forward to the future with FormFast at PCRMC, we are looking forward to implementing FastFlow, as Sharon mentioned. And with FastFlow, this allows for non-clinical forms. I know here at our facility, that would be like vacation request, purchase request, things like that, to be built in the Form Designer and then converted to a fillable PDF, so that rather than printing that form down to paper and filling it out, they can actually fill it out just on the computer. At that point, then we have workflow that can be attached to the form in the background, which allows automated routing throughout the organization. And FastFlow also has the allowance for users to track their form from start to finish. So from the point that they create that, if there's a delay in getting that form approved for some reason, they can actually go into the FastFlow system and see exactly who has that form, where's the stopping point. And then because it's a fillable form within FastFlow, we have the ability to report on the data that's captured on that form. So creating reports as well as dashboards, which allow the live look at the compiled data.
And the other FormFast product that we're hoping to get finalized on implementation this year is the web imprint. This will allow floors to be able to pull select forms up for completion. They can complete them on tablets, iPads, whatever device we choose to allow for. Then they can capture signatures on the designated forms without printing the forms. Forms will then be routed to ImageNow, having never been printed out, which will help with timeliness on getting it in the record, as well as decrease the cost of actually printing to paper. I think it's missing our last slide there, but we'd at this point, that concludes what we have to present on, but we'd like to thank FormFast for allowing us to share our journey with their products. And we've had a great working relationship with them since about 2001. So we're looking forward to implementing web imprint and FastFlow later this year and furthering that relationship.
Great, thanks guys. A great presentation. And we're excited about what you guys are doing at Phelps as well. Take control back here. This time we're going to open it up to questions. If you have questions for Phelps, send those to the Q&A panel on the right side of the screen, or just comments to the chat. One thing I took note of here, and we'll talk about this more in the user forum, but what are some of the challenges that you face due to a lack of standardization that you mentioned?
Really, it was just trying to create a standard and then get everybody educated on that. When users have been able to freely create forms and not have a specific standard or format, bringing everybody on board, it's hard to pull it all together.
And what are some ways that you used FormFast to do that? One thing that comes to my mind that I've seen customers use is form templates that you can design in Form Designer. I'm assuming that was part of it?
Correct. Our forms committee met and developed guidelines that like the patient information had to be at the bottom right-hand page. Our hospital logo, form name, barcode are on the bottom left side of the page. And then, we have margins inside. Our orders had to follow a certain format. And just kind of basic general picture of the layout, so that way every time someone looked at it, they could tell right away, this is our form, here's the patient information, here's the scanning information. And it also helped by having the barcodes in a set location for the scanning system, because they look for a certain spot on the page to be able to recognize that and read it.
Right. Got a few questions coming in for you. Alan would like to know, what drove the selection of your new replacement for Valco?
Well, Valco was, I'm not sure if Alan's familiar, Valco used to, I guess, be their own product, and then Highland bought them out a few years back, and they have decided to sunset Valco, so they are no longer giving updates, supporting it, or they support it, but
it's minimal.
Very minimal support. And so that drove us to look at other scanning and imaging products. We looked at the Highland product, Perceptive. We looked at some others and ended up going with Perceptive.
Gotcha. And Lisa would like to know, can you capture signatures through web form imprint alone, or do you need another module?
That we haven't got far enough along on our implementation, but at this point, from what we've seen, they sign the document, they can sign it right there on the tablet, and it forms onto the image. You can also use like the little signature pads like you sign off on for your credit card at, say, like Walmart. So you're using a device that is putting it on the image.
Right. I think I can speak to that as well. In addition to having a web form imprint, the e-signature functionality is additional, not necessarily a module, but it works with that web form imprint solution. And we can reach out to you, Lisa, about that offline. Another question that came in. FastFlow can involve a lot of stakeholders. What process issues affect going live with FastFlow?
Actually, this is Jess. I'll speak to that. I think primarily for us, what we've faced is what people think they want and what they decide after the fact may not be the same thing. Once you see something built out based on your initial request, you may decide that's not really the way that you want things to work. So just making sure you have some flexibility and understanding the beginning process may not be your end result. Once they see how things will flow, they may decide to make some tweaks, and it usually ends up for the better. But for us anyway, that was one of the biggest challenges.
And then along those lines, you kind of mentioned some of the different applications you were considering for FastFlow, for vacation requests, purchase requests. Can you speak to a little bit of how those are handled today, and then how FastFlow is poised to improve those processes?
Sure. Do you want to speak to that, Melissa?
Well, right now they use multiple part forms. They order it through a vendor, and they fill them out just manually and turn them in, and you never know where the form is or whose desk it's, you know, waiting on for a signature. So with FastFlow, it will be really good. You know, you'll be able to track the form, and you'll know exactly where who's holding up the process, I guess.
And we do have some of our forms currently that we're in the process of converting to FastFlow that are already electronic. They were created just in InfoPath through the Microsoft product. But from a design standpoint, I know my first introduction to InfoPath was mind-blowing. It's just, to me, is not user-friendly at all. Mm-hmm. And the form designer, especially because Melissa has worked in it for so many years, it's the same way she's always designed forms. It's just that additional process of, you know, instead of a regular box that you're drawing a fillable field, and it converts over to that PDF. So from the design standpoint, it is so simplistic. And then also from the standpoint of our InfoPath forms, the intent was for those to remain electronic for electronic submission. However, again, it was never easily configurable, so you would have one individual that knew how to do that, and then when they left, you lose that capability to configure those forms. So this is such an end-user friendly product that even if Melissa wasn't available, she was on vacation or something, somebody could easily pick up the pace and take care of that.
Great. And you spoke to some of the different benefits of FastFlow, including the dashboards for getting insight into those processes, as well as just the overall operational efficiency. What do you see is the biggest benefit for you guys?
Well, as of right now, and since we haven't actually been able to implement that yet, we haven't got to see the full benefits of it. We have one dashboard that we are intending to implement, and we're really looking forward to it. And it's actually going to streamline our capital budget requests and purchases, budgeted purchases, and it will replace a process that's currently done manually on a spreadsheet by an individual in one of our departments. So not only are we making a process much more seamless and accurate, less possibility of human error, but it'll be a time saver. A huge time saver for everybody involved. The ability to go out and immediately look to see, okay, I was allowed this much for my budget, I've made this much in purchases. No more tracking down somebody to find that spreadsheet. So in that sense, we're really looking forward to it. Like I said, we haven't got to see it live in action yet, but we know it's going to be great.
Okay, another question that came in regards to Valco and eSig. Did either of you that have converted from Valco have e-signed images you had to convert?
Do you want me to answer that?
Sure.
The answer is yes. We are actually still in the process of working out a conversion for our e-signed Valco documents. It has not been easy. It's been a lengthy 3-year-long process in getting to this point. And so through a lot of work and a lot of, I don't know, tears. It's not something that's easy to do, but we think we finally are on the right track to get that done.
Okay. And, of course, one of the things we're most excited about for you guys is achieving Stage 6 of the MRAM. You spoke on it briefly, but can you talk a bit more about how FormFast was part of that strategy?
Well, FormFast really kind of helps automate our EHR. It gives us, it's the basis for our electronic record and our scanning of forms and that sort of thing. By barcoding the forms, then, it's making it possible to scan them and get them indexed properly, have a name on them, and then also make sure, not really, I guess it doesn't help with stage 6, but it helps make sure that they're compliant with regulations, which that also helps with, like our RACs, our Joint Commission, just any type of thing like that. So, it's really just the basis for having that electronic record. I don't know how we would do it without it, honestly.
And stage 7 would never be even a possibility for us if it were not for these consistent barcoded forms designed in FormFast. So that, the goal for us to meet stage 7, we wouldn't be able to do it without it.
That's great to hear. You also mentioned that the cost-saving benefits were significant. Did you have any metrics offhand? And I know I'm kind of putting you on the spot, but do you have any specific numbers you can share about some of those savings?
Well, Melissa went back. We don't have any for current right now, what it's saved us, but when she went back to some notes she had from back in, was it 2002?
It was from 2001 to 2002, when it was initially being set up. The cost savings was $44,000 that first year of the pre-printed forms. We weren't having to order anymore because now we have it all on, on Form Central. So that's considerable savings.
And
that's great. It's fantastic.
Yeah, we have one form right now that the switch to a more electronic basis for it. However, we have changes that need to be made, but we still have paper copies out there. And we're debating, do we update the forms with like a sticker or something like that, because we have so many pre-printed forms on hand. And, do we waste that money or how do we do it? And we're hoping to make that decision quickly, but go strictly to like a FormFast form where, they print it out and we don't have to worry about if there's a compliance change or something. We have to either wait or figure out a way to update that form. So we're hoping to...
you have to eat a lot of cost.
Yeah, you do eat a lot of cost.
You eat a lot of cost. Because it's already pre-printed, right, on paper, so, yeah. It'll save us a lot.
That's perfect. Looking to see if there's any other questions. We have a few comments coming in that, let's see, Alan wanted to note that they were a Valco shop that converted to OnBase. And Laura is sharing that they moved from Valco to Perceptive. I believe that she's going to share some information via chat. And then we also have a question coming in from Kathy. What is your printer/tray configuration for labels/multi-part forms, etc.?
I'm sorry, I don't understand the question, I guess.
What is your printer tray configuration for labels/multi-part forms? I think is the way it's phrased.
We don't really print multi-part forms. We used to purchase multi-part paper and print out copies of each form, but we don't really do that anymore.
We don't. Yeah, we don't print multi-parts in-house.
Yeah.
The like if she's talking like printing, say barcodes and face sheets like that, we do that through Metatech and not through the FormFast product.
Okay.
I don't know if that answers the question or.
Yeah, I believe that covers it. Another question just came in. What made you consider workflow alternatives to complement what you could do with Perceptive's workflow?
Well, we tried doing Perceptive's workflow, but it wasn't what we were looking for necessarily, or what we had anticipated.
In terms of their eForms. So,
correct.
I mean, we are using their workflow for everything. Once it's scanned in, there will be workflow associated to route it throughout the department, get it indexed, and add deficiencies, things like that. But as far as the eForms, that's where the eForms and Perceptive did not meet the needs that we required here at our facility. So it was more the form than the workflow that was the issue.
Of course, like you said, that we feel like that's a strong suit here at FormFast. It's so easy to create eForms, like you mentioned, having one tool to create forms for print and for workflow, and the ease of use. So we're proud of that. Glad that you mentioned that. I'm looking to see if there's any final questions before we move on to the next session. And it looks like that might be it. If you have any questions for Phelps, feel free to send me those, and I'll pass them along after the session. But this time, I'd like to thank Melissa, Sharon, and Jessica for being here. Great presentation.
Thank you.
Thank you.
Okay, with that being said, we're going to move forward to the next session, and that's going to be our user forum panel discussion. If you're a new user of FormFast, this would be a great chance to learn about ways to improve your implementation from users who've already had some success with the solution. We're going to keep the questions going. We encourage you to send those to the Q&A panel as you've been doing, and I'll try to work them into the questions as we go. We also want to hear your comments as well. We want to find out about how you're using FormFast and some of your experiences, so feel free to share those in the chat panel. So to get the session started, I'd like to introduce today's panel. We are joined by Dina Daniel from Health Central Hospital, Carolyn Cyrus from Centra, Jennifer Barron from St. Mary's Medical Center, and then Eric Ballard from FormFast. So I'm just going to take everyone off of mute here. And do we have everyone connected?
This is Eric.
This is Jennifer.
This is Carolyn.
Sounds like we have Carolyn there and Dina. Okay. Very, very good. Well, to get us started here, I'd like to go around the group and have you each introduce yourself. Tell us, once again, your name, title, your organization, your bed size, how long you've been a FormFast customer, what FormFast products you use, any information you could share about the number of documents or forms that you're processing. So I want to start with Dina.
Hi, I'm a system analyst at Health Central Hospital. We implemented FormFast July of last year. We started in the ED registration area for electronic signatures and the admitting process through ER, so we could do true bedside registration. In April, we launched FormFast throughout the rest of the house. We have about 1,100 forms. We're using the obvious Form Designer, Job Designer, Print Suites, and Web Form Imprint, and e-signature.
Okay, and then next we'll go to Carolyn.
Hi, I am a systems analyst at Central Health in Lynchburg, Virginia. We have multiple facilities. We have several hospitals, and then we also have some long-term care facilities. So we've got around 1,100 beds. We started using FormFast. I went live with FormFast in October 2005. So we've been using it for quite a while. Mainly we use it for the automated admission forms. We have implemented the e-signature for those forms, and then we have, I would guess, a couple of thousand clinical forms that we're using, and so it's quite a tool, and everyone, you can tell when if there's ever an issue with FormFast, you're going to know about it because everybody depends on it.
Perfect. Next, I'll move to Jennifer.
Hi, this is Jennifer Barron, and I'm with Ascension Health Information Services. We are an outsourced IT for St. Mary's Medical Center. And St. Mary's Medical Center is in Evansville, Indiana. We have a bed size of approximately 473 at our main campus.
We also have entities in Warwick County. We have SurgiCares, all our physician offices, and convenient cares. We have been a FormFast customer since 2006. And currently we are using the FormFast products of Print Designer, Print Manager. Form Imprint is used throughout the hospital in all clinical areas. Form Designer, we have a data integrity group that does our form designing in the HIM department. We use this for admission applications, auto prints upon admission. We utilize a FormFast downtime application when our main ADT system is down, and we also have an HL7 that flows from our ADT into our Form Imprint database. We are currently processing a little under 7,000 forms, and we continue to use those for clinical, for protocols, for doctor's orders. We have patient education, and many more forms in our resume there.
Perfect. And then Eric is here to answer any more technical questions that I can't speak to during this session, as well as sharing some of his experiences working with multiple FormFast customers. Eric, do you mind filling us in a little bit about who you are and what you do at FormFast?
Sure, good morning. I'm a Senior Solutions Consultant here at FormFast for about a year and a half. I've been in the forms automation industry for about 8 or 9 years now, implementing various solutions at hospitals, e-signature solutions, automatic printing, on-demand printing, EMR integration solutions, as well as helping customers overcome issues and questions as internal issues that relate to the use and best practices of these types of solutions. So I'm happy to help answer questions and provide advice where necessary.
Great. So to get us started here, I wonder if you could tell us a little bit about the reason why FormFast was brought into your organization, and I'll open that up to anyone in the group.
Well, this is Jennifer Barron with St. Mary's, and we started using FormFast to implement our, it's called Horizon Patient Folder from McKesson, where we could have our medical records online for doctors, clinicians, etc. So we had to get our forms in line. They had to be barcoded, of course, with all patient information and document type information to be able to scan those through our DCS system and bring them into our online medical record. And so FormFast was the first step to getting that done.
Okay, and then Dina, I think you're a McKesson customer as well. Is that correct?
Yes, we are. We implemented FormFast to take over Optio. Apparently the server was pretty old. I kind of inherited the project midstream, but we use HPS, and we use the ILE piece that launches FormFast for the e-signature, and that's been a really good time saver for the registration staff.
Great. And Carolyn, I assume that you had a similar story. I think you're using HPF as well.
That's correct. When we went live in 2005, of course, we went live with a suite of the McKesson products at the same time, STAR, HPF, and the clinical products, and we implemented FormFast at the same time. I think at that point, and I believe they still are McKesson partners with FormFast, and McKesson highly recommended FormFast to us as a form solution. So that's where we started, kind of like the others.
So what were some of the challenges you were facing before FormFast came in related to manual documents and pre-printed forms?
I think at our site, similar to what at Phelps, I believe it was, that, you know, we had some users that if they needed a form, they just got into Word and created their own form. So, you know, we did lack the standards there. So We did have a printing shop, and since implementing FormFast, we've eliminated the print shop, as well as now the forms are standardized. And by having them in FormFast, it's wonderful that the latest version, everybody has access to that. So I think we all had some similar things there, and I'm sure some people had some different issues as well.
Sure, Jennifer or Dina, anything other than those challenges?
This is Jennifer, and basically our story was the same. We had people using forms coming from all different areas that weren't compliant with the correct version of the form. They weren't following Joint Commission or CMS regulations. Pharmaceuticals, things were not being checked. Now everything is regulatory, put through in a standard format. We have a forms committee that has to approve and look at forms before they go live. So it's just a much better process with FormFast.
Okay. And what
did you?
Go ahead, Eric.
How did you ladies find the end user adoption, and with the changes? Was it what kind of I guess hurdles did you have to overcome with user adoption and user acceptance of these new processes, and how long did it take before they really owned and loved the new process?
Well, I'm sorry, this is Dina, but we pretty much had standards for the most part in Optio as well, with a few exceptions. The biggest thing that I think that FormFast helped us with, especially on the design part, is the templates that you can build and the ease of actually scanning in a form and creating it from there. Our previous software platform, it was a blank screen, and the designer had to design every piece of it. So we can create forms on the fly a lot quicker now, and I think that's been very helpful. That's just from the design perspective.
This is Carolyn. I think from the end user perspective, as far as on the nursing units, I believe it was greatly received that, the forms are there. Anytime that they needed a form, they can go into Form Imprint, and it's right there at the click of a button. So, and of course, then they don't have to worry about stocking forms on the floor, and of course, knowing that they do have the latest version. So I can't remember any issues that we've had at all with the end users accepting it.
And this is Jennifer. That's basically our story as well. Most departments, as we brought them up on this, were extremely receptive to the ideal of being able to print their forms on demand, not having to take up precious space in certain clinical areas to store their forms and always have to keep those stocked, especially the auto print of forms, because we have those programmed upon registration to go to the floor that the patient's going to. So that has also saved a lot of precious end user time as well.
And we have a comment go ahead.
Sorry, it's Dina again. We use the web form imprint, and the biggest adoption from the nursing staff is the ability to print the same form. Like if they have 4 patients that are being discharged, they can print all their discharge paperwork for every single one of the patients that are being discharged all at once. They don't have to print. They don't have to pick this patient and then print, pick 10 different forms and then go and pick the next patient and then pick all the different forms. So the ability to print multiple forms has been a huge adoption from the nursing staff.
We just got a comment in on the Q&A. Just a comment, says Rosaline. Jennifer and Caroline seem to have a similar setup as us. FormFast and HPF, we print our forms from series, but want to now use those same forms for some additional purposes with e-signature. But we do want to control the forms. But we do control the form, she says, and don't have anyone to create on the fly. So it sounds like there's a lot of similar stories out there, with especially with HPF and McKesson. If anyone that wants to share their experiences with Meditech, feel free to send those comments into the chat or Q&A. So how long did the adoption process take in your cases?
I think as far as Centra, the adoption as far as the staff using it, or the adoption as far as converting over from the existing forms to the FormFast?
As far as the staff using it?
I think it was, you know, as soon as they knew it was there and they showed them how to use it, I think the adoption went, you know, pretty smoothly, and doesn't take a lot of training for the end users to use it. Now, when we were converting from the manual forms or paper forms to FormFast, that took a great deal of time. We did have to bring in some temp employees to help convert those, but once they were converted, now we have one person that is our forms design person, and she handles all of that work and does a terrific job.
What about at St. Mary's and Health Central? How many people are on the form design team?
Oh, this is Jennifer at St. Mary's, and in the very beginning, we have a print shop department. So we had one person in there working on and creating the new forms. However, we took one department or two departments at a time to bring live in the hospital, not the entire department at one time. So that helped out. That helped us with our organization. But now, currently, our form design and changing is done in our HIM department in a data integrity. So we have two people now with the amount of forms we have.
Hi, and this is Dina. And we actually purchased the conversion package from FormFast, where FormFast actually converted all of our forms to the PCL files needed for FormFast. So the way we manage it is now that because we didn't have the design file, FormFast didn't give us the design file. They just kind of gave us basically a PDF of what we already had. So now if there's any changes that need to be done, our form designer in our HIS department goes through the forms committee, and then she builds it in FormFast. So that was a really big time saver, that we didn't have to build all the forms.
And I should note for users on the call here who might not be aware of that, we do offer those form design services. We have a team of form designers who do nothing all day but make forms. So if you feel like your staff on site is a little swamped, then we'd be happy to create some forms for you. So feel free to reach out.
Erin, this is Jennifer. We also used your form design service for a percentage of our forms in the very beginning as well.
Perfect.
And we did too at Centra, and particularly if it was a complicated form and we were just learning. So they were a great help with that.
Yeah, they were very good to work with.
And Eric, do you find that to be pretty common to get a hospital started? You know, would you suggest having us do a percentage of the forms to kind of get the ball rolling, as it were? We might have lost Eric for a second there.
Oh, I'm sorry, I was talking into a muted phone. I apologize. Yeah, I certainly agree with you. If you have FormFast give you a foundation of your forms, even if it's a small foundation, it really helps the learning process for your staff to understand what's involved in designing a form, and really not just so much the fundamentals of how you design a form, but why you actually perform certain steps when designing a form. And that certainly helps when you've got some existing forms that are your actual forms to look back at that are in the solution. And certainly through the form design process with us, you'll have built a relationship with at least one form designer from our side, and there's obviously a huge benefit there as well as you design forms yourself.
Go ahead.
I'm sorry. One of the challenges that we ran into a while back was, of course, all of our forms were in English, and then we had to have some forms converted over to Spanish, and, you know, we did not have anybody working with the forms that knew Spanish, so some of those, you know, we worked with FormFast, and also I think that they sent us a Spanish dictionary or whatever to help convert those forms. So that may be a challenge for some of the sites.
That's great you actually mentioned that. I was speaking to the form designer who's going to be leading our tips and tricks session later on this afternoon, and she's actually going to talk about Spanish forms in particular. So that's a great segue into promoting that this afternoon. So if you're struggling with foreign language forms, definitely check out the form designer tips and tricks breakout session. Let's see, as we're talking about the early stages of the process, what other advice could you give in order to get the best start with FormFast? What people would you have involved in the process? What processes would you put in place?
Erin, will you repeat that question, please?
Sure. So for new FormFast users who are just getting started, in addition to having that foundation of forms that Eric talked about, what processes would you recommend a new user put in place, or what people would you suggest get involved with the process?
I'm sorry, this is Dina. One of the biggest activities that I did was to verify what forms actually needed to be built. And I don't know if any other sites have this issue, but there's a lot of forms that have been produced over the years that are no longer used. So I took meetings with every single department director and said, look, I need to verify that your staff is using this form. And so we were able to cut probably 20% of the build just by going through that process. So I would definitely involve the nursing directors, your HIS department with HPF. They have the ability to do a cold feed into HPF for the printed or e-signature forms. You just have to have the document name from HPF, and it can actually just get dropped into HPF for you. So if you have an HPF analyst, I would suggest that they get involved as well.
And this is
yeah, one thing I would recommend as well is, as best as possible, get some frontline personnel involved as well. If that's a registrar, that could be a unit secretary, even a nursing staff. Those frontline team members can be hugely beneficial when helping with these forms and these processes, because they know them, they use them every day. So there's often a lot of insight that they can bring that may help in the form design process, as it is a chance to review your processes and review your forms if the project has the opportunity to do that built into it.
I'm sorry, this is Dina again. I want to mention also one of the biggest hurdles that we had here was apparently the way it was set up prior to FormFast is we had many different data streams coming from STAR that held different information. For example, the blue embosser cards, I don't know if anybody still uses those, but we had a very small amount of data that was being sent to produce the blue embosser cards. But for the face sheet, we had larger quantities of information coming over. So we kind of took a step back and said, can we just send one data stream over from STAR, because then you can basically train or set up rules in FormFast that says, hey, if it's an inpatient admission, I want it to print X, Y, and Z. And then you're not sending over multiple data streams. So.
Now, we do something similar to that where we're sending over the forms from STAR over to FormFast, but we do have probably about 5 different ones because we give the users the option in STAR. Do you want to print all the forms, which would be like face sheets, armbands, labels, or any forms that's associated with the patient type? Or do you just want to reprint the face sheet, or do you want to just print labels, or do you want to just print an armband? So we do have the different ones because there's a variable in there, and there may be a better way to do it, but it sends a variable across it. I want armbands. It's basically the same data, but it does tell FormFast that go through the armband flow and just reprint the armband, or whichever form they select in STAR. But we try to keep our data consistent, too, in those forms. That way, you know, whether you're sending from one flow or another flow, you've got the same data that's going across.
So for those using web form imprint, how many print jobs do you manage? And what are some recommendations that you would make to better manage that structure?
At Centra, we're not using the web imprint at this point. We're still using form imprint through Citrix. And we started out with Citrix, and that's worked very well for us. So at some point we may switch over in some of the units to use the web imprint, because I think you can use both, or depending on which way that you want to do it. It seemed like with the web imprint, and I think it's been improved since we looked at it, that the nursing units would have to go in and select their printer maybe the first time. And since we have like 4,000 nurses, and we didn't know if each nurse would have to select a printer or if it was based on the unit, that's one of the reasons we've opted not to go with the web imprint. But I think it's been improved since we first looked at it.
Sure. Eric, can you speak to some of the new benefits of upgrading to web form imprint versus form imprint?
Yeah, absolutely. With the new web form imprint, if you're migrating from the thick client to the new client, you have a lot of great benefits, mostly having to do with printing and filtering of not only your patient's information, but also what we call the document tree, the list of your forms. With the web form imprint model, everything's basically stored in SQL in terms of the settings, the filters. So it's as easy as creating a SQL query that says a given user or a given group of users can see certain patient types, service code, admit dates, statuses, and so on, as well as what forms that they can see. Not to mention one of the best features in web form imprint is the ability to print to your workstation's default printer. And this is available in the thick client, but to have this feature in a web application is a great benefit moving forward to a thin application. As well as, obviously, when you go with a web form imprint, you have much more centralized maintenance, troubleshooting, and configuration of the solution as a whole. So it can really help with the help desk and IT, IS staff supporting the FormFast solution.
Can you do electronic signature with the web imprint?
Absolutely, yes, you can.
Okay.
In fact, you can also do on-demand electronic signature capture as well, which means if a form wasn't initially triggered for electronic signature capture through the automated process, with just a click of a button, you can select your patient and click on the what we call it the capture client or the annotation client, click that button, and it immediately will take you to, obviously select your form as well. It'll take you to a version of that form that's ready to be electronically signed. So not only can you print forms on demand, you can sign your forms, but you can also do on-demand e-signature process as well, which can be very beneficial, especially up on the floors or bedside e-signature processes where a patient might throw you a new insurance. I forgot, here's my Medicare card. Well, now we need to have you sign the important message from Medicare. Well, that's easy now. You can very, very rapidly sign that form without having to jump through too many hoops, or print the form and scan it in on the back end.
So for those on-demand forms, then, when you're setting them up, you need to add the boxes for the signatures?
That's correct. Yeah, you do obviously configure that process on the back end, but from the end user's perspective, it's really just select your patient, select your form, and click the e-sig button, and it takes you to the client to sign that form electronically. So it's really just a nice, three-step process.
I'm sorry, this is Jennifer. On those e-sig forms, can there be multiple signatures on that form, or can you utilize that for cancer staging forms?
Absolutely. It really depends on the device you're using to capture your signatures. If you're using, for example, a ClipGem device, which is essentially a clipboard that is, which is a product of Topaz, in it, you put a piece of paper or a laminated copy of a form on, you can sign it. In that case, the patient can simply fill the form out, or the registrar, the nurse, can fill out the form as needed, as if they were filling out a regular piece of paper. If you're using a smaller device, like a SIG Lite or SIG Gem, different various smaller devices like you might see at a grocery store, yes, absolutely. You can have multiple signatures, so we can have a place for the patient to sign, the witness to sign. They might even be able to, you might have them fill in a date or some other information that they need as well. Not just e-signatures, but really patient data entry.
Mm-hmm. Thank you.
Mm-hmm.
And just in general, as technologies like e-signature becomes more prevalent, like at the grocery store, at a hardware store, wherever in the consumer space, do you find that patients have come to expect that in the hospital as well?
I'm sorry, it's Dina. We haven't had any issues. We've had one person complain about the e-signature, but it's anywhere you go anymore, you're just signing your name. So.
And can you speak to how that's improved the workflow with scanning consent? Eliminating that scanning. Can you give us any thoughts around that?
This is Dina again. Yes. Typically what used to happen in the registration process is they admit the patient, all the paperwork prints, they have to go to the printer, pick it up, take it back, have the patient sign all the forms, then they would go and scan it all in, put it in the shredder box, and then they would have to choose basically, like, I want this to go into HPF under consents or face sheet or what have you. So now, as soon as the patient signs it, they archive it, it automatically does it all for them. The reduction in cost for paper has gone way down, and the time it takes to get a patient fully registered has gone down.
Oh, excuse me, I was on mute. Sorry for the silence there. For the rest of the group, how many consents do you see on a daily basis or a weekly basis?
I'm sorry, how many what do we see?
Consents that you have to scan into your system?
I can't really say how many we have. I know we do have like a lot of the release of information forms, some consent forms, some other forms that are required. I think we're coming out with a new one. It's in July. It's motor vehicle accident form that's got to have a signature on there. So we're adding more all the time. With that one, what we're going to do is have the electronic signatures as well as require them to enter in the date on the signature pad, which we've not done in the past.
Gotcha. And obviously there's a lot of buzz about around mobile devices in healthcare, and that's part of what we're offering with our mobile e-signature solution. What sort of interest have you seen in mobile devices in your organization?
As far as Centra, we're looking into, and they're testing out an iPad rounding system right now. It seems like iPads and iPhones, you know, everybody, all the staff wants them, and they want all the applications on there. For the registration forms, the automated forms, we are looking at putting e-signature forms into iPad. After we upgrade FormFast, we've still got that on our list to do, but our registration and patient access people are pushing pretty hard to get that. So we're looking forward to trying that out.
And this is Jennifer with St. Mary's. We have a great interest in that and currently do utilize it for physician rounding in the hospitals for their patient list, through MData, through our e-clinicals, in doctors' offices that is used to update the patient information online. We don't, as such, use e-signature through FormFast as of yet, though.
We have a question coming in the chat. Does anyone have any experience with the Surface versus the iPad? I believe the Surface is made by Microsoft. Anyone speak to that?
This is Eric. I do know we have some customers who are actively either using or certainly looking into using the Microsoft Surface. So it's certainly a device that's up and coming in hospitals that I'm running into. Really, from an end user perspective, it's kind of treated the same as a tablet PC. From a technical perspective, there's a few hurdles to overcome, mostly to do with the hardware and the cost of the device.
So for the group, what seems to be the most requested platform? Is it the iPad? Is it a mix? Is Android prevalent? What do you see in your organization?
This is Jennifer, St. Mary's. We use tablets.
Okay.
And Androids are up and coming now.
This is Dina. We use tablet PCs.
And at Centra, we use some tablet PCs as well as the iPads, and we're going more to the iPads.
Gotcha. That's good validation of our strategy here at FormFast. As we've built that solution as an HTML5 based mobile solution, so it will work on all those different platforms. So that's good to hear. And, you know, also that allows us to make solutions for different use cases. So for bedside consent, we feel like the iPad or a tablet like that is useful versus that registration, having a dual screen setup to have a little more real estate. that's good validation, like I said, of our overall strategy. So how are you dealing with the challenge of BYOD, or bring your own device? Are staff trying to bring their personal devices in? Do you have policies in place to help control that?
At Central, we have had some requests where people want to bring in their own iPhones, their own iPads, and then they want their Central email or applications on there. I think what they do, our security group and our desktop people, they load an application on there. I believe it's ZenApp. And then also they have to be told or are told that, you know, if they leave Central, that this ZenApp will automatically wipe off the whatever information that's on there from Centra. But I think it is a challenge when you have somebody bring in their own device like that, because then it's like, well, if there are problems, they expect our staff to help them with that. And being their device, you can only go so far. I believe as far as support goes, it's easier if the device is owned by the company. And then if there's problems, it's more a consistent platform that way too.
And this is Jennifer, St. Mary's, Evansville. We have an accepted list of devices that can be utilized. And when those devices are utilized, then encryption is put on each one.
Another question that came in the chat here. From your experience, how is the quality of the signature with the e-signature solution? Maybe, Dina, you can speak to that.
The quality of it?
Mm-hmm.
It's superb, with no issues with it.
Perfect. In terms of other initiatives on the horizon, we know that, of course, healthcare has there's a lot of different irons in the fire. What are the major initiatives that are taking a mind share in the minds of leaders of your organization? Is it meaningful use? Is it ICD-10, ACO creation? What seems to be the big drivers?
I think it's probably all of the above as far as the big drivers. With healthcare and the Affordable Care Act, I think that a lot of hospitals, and certainly we are too, we're watching the dollars a lot closer than we have in the past. But we're also hearing more about the cloud solutions and ASPs versus storing things in-house and having servers in-house.
What about for the rest of you? What seems to be the main focus of the organization?
Well, this is Jennifer with St. Mary's. Ours is the ICD-10. It is meaningful use. Meaningful use is a really big push at this point in time. And, you know, watching everything with what the government regulations are putting out at this point as well, being very careful. But those are our main focuses right now.
And from the reports that I've read, it seems to indicate that reimbursements are declining. Do you find that that's true? And if so, how's that affecting your organization?
As Jennifer said, I think that, you know, at Centra too, we are a lot more careful and with the money that we have, and also as like most healthcare organizations, I think they're expecting, or the expectations are that we do more with less. And I can't really speak as far as the reimbursements, whether they're low or not. I assume that they are, but
Well, that's a good segue into my next question about process improvement in general. In the past, we've partnered with leaders of process improvement methodologies like Lean or Six Sigma. You might have recalled our webinar we did a while back with Lean expert Mark Graben. Are these methods like Lean and Six Sigma used in your organization to help you do more with less?
This is Jennifer with St. Mary's. Yes, both of those are used within our medical centers.
And we use the Six Sigma at Central to help improve processes.
And how do you think that FormFast fits into that methodology, if at all?
Well, this is Jennifer St. Mary's. It's just a leaner way of producing needed documentation and forms on an as-needed basis only. So, you know, it's cutting our processes down on what needs to be done to produce those forms, just making it more efficient, at least leaning towards the lean process.
In terms of other movements and initiatives, the term going green has seemed to diminish in the cultural vocabulary, but certainly the understanding of the need to be more environmentally conscious is more important than ever. How important is being eco-friendly at your organization, and how has FormFast contributed to that effort?
As far as Central, I think just using the e-signatures and the cold feeds directly to HBF has greatly helped that in reducing the amount of paper that's produced. And it's a great time saver for the staff too, not having to scan in that information.
Perfect.
I would agree with that.
Go ahead, Dina.
Just say that you know, giving them the ability to only print the exact forms that they need at the time that they need it is a big time saver and very eco-friendly.
Perfect. Well, this time I'm opening up to final questions for the group. We've touched on a number of different subjects here, so feel free to send questions in on any of those topics, including e-signature, web form imprint, HIS integration, hospital initiatives, and then we'll present those to the panel here. And we got a question in going back to e-signature. With those who've used multiple devices, do they see anyone with better quality of signature, smooth versus jagged-like? And Dean, I think that you're using that one solution, so if you can speak to that, it's fine. Or Eric, if you want to speak to the different types of devices that we support.
I'm sorry, this is Dina. We just use the signature pads at this time. We've also we have the tablet PCs that you can sign on there, and either one comes out with a beautiful signature. I've not seen any quality diminishes from tablet to the LCD screen or the tablet screen, but those are the only devices we use.
Yeah, this is Eric. Yeah, I've implemented facilities that actually use a combination of devices from the clip gems to the SIG lights to even tablet PCs, and there really is no noticeable difference that I've experienced, that my customers have experienced with the quality of the signature. When the form is sent to the EMR solution, I think you'll find it quite difficult to differentiate what device was used to capture that signature, because the quality is really nice and very consistent. So in the end, you're choosing a device. Yeah, it really, in the end, yeah, it's no problem. Really, in the end, choosing a device is really going to be the format of the environment that it will be in. So that really should be first and foremost. Obviously, cost will play into that as well, but that's really how I would work that issue.
I was just going to say, I mean, I would be more than willing to give an example of what it looks like, obviously without patient data, if anybody's interested.
That's great. And if anybody would like that information, just feel free to send me their contact info, and I'll pass you along to Dina so that you can talk offline. Just send me that information via chat. And there was a chat that I missed earlier in the conversation. Maggie would like to know if anybody currently is using our system with Quadramed, QCP, R, Affinity, or EDM. So if there's anyone listening in who's using those systems, send us a chat, and then we'll make sure to pass you along to Maggie as well. Looking to see if there's any other final questions. And it looks like that's it for now. I appreciate the panel for being with us, Dina Daniel, Carolyn Cyrus, Jennifer Barron, and Eric Ballard. Great conversation today, and we appreciate your time.
Thank you.
Thank you.
For our next segment, I'm going to turn the meeting over to Jordan Miller, a workflow specialist here at FormFast. Jordan has a long tenure in health IT, working for other health IT providers before coming to FormFast. As I mentioned, he was recently featured as an educational speaker at the Muse conference. Today he'll be talking about some of the ways that workflow can be used to improve hospital operations. So Jordan, it's all yours. And I believe Jordan's connecting now. Jordan, are you there?
Sorry, much like Eric, I was talking to a muted phone. I apologize. Good morning, everyone, or afternoon for some of you now. Today we're going to be running through a presentation talking a little bit about gap workflow, explaining a little bit what that is and what that might mean to your organization. I would love to keep this as interactive as possible as we're kind of running through this part of the session today. So feel free to hit me up on the WebEx chat or using the Q&A function as we get going here. And so with that, I'm just going to navigate through that. Aaron, is that changing the slide? Is that updating for everybody? Good to go. All right, so today, a couple of the things that we're going to be talking about. First and foremost, we're going to be reviewing the hospital IT landscape. So common things that we see when we're out working with our over 1,000 customers, the solutions that they have in place, for their EMR, or the types of solutions really, and we're going to kind of categorize those into two different groups. Then we're going to talk about the goals for workflow automation. So, at FormFast, we spend a lot of time talking about workflow automation, and we kind of have a culture of just general workflow improvement. And that can mean a lot of different things to a lot of different people, but we want to have some tangible objectives of things people are trying to achieve when they're implementing our solutions and when they're building out things for their organization. We're going to talk about some of the challenges and barriers to getting those solutions up and live and what that might mean for an organization. And we're going to talk about the gap workflow approach. So this is a little bit of a unique spin on providing workflow solutions for an organization, especially within the context of the existing IT ecosystem. So how your overall IT landscape is really impacted by FormFast workflow automation solution. So after that, after we talk about and introduce gap workflow, we'll go through several different examples of solutions that our clients have rolled out using our workflow automation platform, beyond just the print management and output management workflow that so many of us are already familiar with when we're using FormFast solutions. So, we'll talk a little bit more about that, and then we'll kind of wrap up with just some question and answer, from everything else. So when we talk about today's hospital, and we're out engaging with our customers, a lot of our conversations really revolve around these four different things. So the first thing that we end up always talking about is the paper chase. So this is very much the paper chase that goes on. You know, we may be dealing with a net new customer who's not yet using our output solutions or electronic signature solutions, who's still generating paper when a patient admits, having the patient fill those forms out, sign those forms. They might be putting those in the chart. That chart may be staying with the patient throughout their visit and then ending up down in medical records to get scanned in, or, you know, worst case, to get filed away down in the medical records department. So that's an example of the paper chase, you know, for a typical clinical encounter. But often we find ourselves in conversations talking with clients who have paper chases in HR, in accounts payable, in other non-clinical areas. So that paper chase has a lot of problems associated with it. Many of our clients have realized some benefits of eliminating, you know, the obstacles and risks associated with pushing paper through their clinical processes, and we want to talk about how we can help bring that same sophistication and that same efficiency to non-clinical areas as well. So paper chase is the first one. The second is the idea of information silos, and this is really important because, you know, no matter what type of hospital you are, what IT systems you have in place, oftentimes information is stored in a variety of different locations. So looking for solutions, looking for things that can help tap into those very disparate data sources and make, you know, intelligent decisions based on those is very, very important. You know, we want to eliminate different systems from housing data and having to jump into those different systems for end users, but we also want to, you know, eliminate the need to keep things like offline spreadsheets that, you know, the Capital Budget Committee is maintaining. We want to eliminate, you know, all of that knowledge that might be just in someone's inbox in their email client rather than, you know, in another system online that others can access and make intelligent decisions based on. Doing more with less, you know, just listening to the conversation today, listening to the panel that just got done discussing, a lot of folks are being asked to do more with less. And, you know, we want to help facilitate that as well. So, you know, we want to talk about solutions that are going to save time, so give you time back. We want to talk about solutions that are going to help you save money. So that might be saving paper, that might be freeing up resources to go focus on other tasks so you can do more with less people, which ultimately, you know, impacts your bottom line. But it's just a constant cycle of improvement. And we don't just want to stop with the first iteration. You know, we kind of want to get a process out there and then continually refine it. You know, the FormFast solutions that we're going to be talking about don't have to be perfect right out of the gate because they can evolve and they can change as your processes ultimately will do. So we talk about that. And then finally, you know, we find ourselves talking about gaps in workflow. And that's really what a lot of this presentation is about. And the idea behind gap workflow is that no matter what systems you have in place, you're going to find that a lot of them have some gaps. So, you know, no matter if we're dealing with, you know, someone using Healthplan or someone using Epic or someone using Lawson, a lot of these big enterprise packages have paper processes either at the start or the finish. Usually the bulk of what goes on in the middle is done, you know, purely electronically, but there are these gaps, these last mile processes that we want to help eliminate. So we do that. We've been doing that for over 20 years in the output management space, but we want to bring, again, that same technology to your non-clinical areas and to other areas in the departments that still are pushing paper and have, you know, processes in email, processes that are going through inter-office mail. We want to help eliminate those. So, you know, definitely let me know if any of those topics resonate with you. We find a lot of our conversations resonating around those. When we kind of jump in, we talk about the landscape that's running at these different hospitals. First and foremost, you know, a lot of times we're talking to people who run a single vendor. So this might be a Meditech or a McKesson or a Paragon, where their clinical system is also what they're using for HIM, is also what they're using for human resources and finance and, you know, supply chain. So there are some benefits to this approach. You know, when you're working with a single vendor that's providing a great deal of these solutions, you get more integrated applications. So a little bit of that conversation around information being siloed and disparate systems goes away. Not all of it, though, because there's still information, you know, that's digested from the mothership, if you will, that might still exist in a spreadsheet or in someone's inbox. Other benefits, though, you have a single vendor to work with and to partner with as you're, you know, seeking support, as you're wanting to figure out how to use something. So that one-to-one relationship can be beneficial. You get a lot of core core applications with this approach. And a lot of times that translates to a lot of bang for your buck. You know, Meditech and McKesson shops, Paragon shops, they, you know, are able to, on a single contract, get something that does not only their clinicals, but all these other areas for them. In that same breath, however, it may not have all of the functionality that, you know, a best-of-breed approach, which we're going to talk about in just a moment, might offer. You know, if you were using Epic for your clinicals and Lawson for finance and PeopleSoft for HR, coming up with a lot of different point solutions sometimes can provide a greater coverage of all the things that you may want to do. But ultimately, we find that a lot of our clients tell us that a single platform and a single vendor solution is more cost-effective for them, and it results in a lower cost of ownership. Again, that whole bang for your buck, that's kind of the idea with that single platform. When we talk about a best-of-breed approach, you know, this is just an idea where I might be an organization that's going out and getting, in my opinion, or our physician's opinion, the best clinical system. Our finance department may have the ability to select, you know, the best ERP system to do accounts payable and invoicing and RGL and everything else. You know, our HR department may have the ability to go select the best HRIS. We might be, you know, our contracting team may go get a point solution for that. Our you know, quality team may go get a custom incident reporting solution, and on and on and on. So these niche solutions can offer a lot of tailored functionality because they're, you know, the goal of the solution is just to address a more limited set of functionality, and it's not just a bunch of modules working together to provide a lot of functionality. It can offer a greater deal of functionality and a more complete story. The downside to that is that it can be expensive. Not only is it expensive to go buy a lot of these individual solutions on their own, it can be expensive to maintain and support them. You know, oftentimes you have to have a single analyst to support each one of these additional systems that you bring on. And so it can be expensive from an operational or just employee FTE standpoint. There can be integration challenges, so getting all these disparate systems to talk together, that can be, you know, another potential barrier. And then just support and training overhead. Having your users have to jump in and out of different systems depending on what they want to do can oftentimes provide obstacles, you know, for adoption when you're doing this best-of-breed approach. Typically for the departments, it's not really an issue, but when you start rolling things out to end users, having 9 or 10 different solutions that they have to remember which one that they need to do can prevent adoption. So there are benefits and challenges, you know, to both of these approaches. But in either example, you know, we're trying to use these IT systems to impact our workflow and make positive change in an organization. So the goals for workflow automation are the same no matter what your landscape looks like. You know, we're wanting to help inter-department, you know, different departments communicate with one another more efficiently, more effectively. We're wanting to have greater visibility into the data, into where things are in a process, into the discrete data that's being, you know, filled out in those forms or in those things that are going through that process, so that we can report on them, so that we can make decisions based on information and have, you know, a little bit more visibility to that. We want to gain efficiency, so we want to build intelligence and automation into, you know, a workflow solution or into these solutions, so that people get notifications at the right time, so that people are prompted to take action appropriately. We want to be able to improve auditing and accountability. So, you know, that whole idea is we want to have transaction level logging whenever someone goes into a solution and makes a change or makes an approval or something. We want to be able to, you know, show when a user did that and, you know, why they did that, and be able to produce that so that we have that accountability, so that we can produce those audit reports. For anyone, the Joint Commission or any other auditor who may be coming in to look at our books or look at our records or anything like that. The other piece of the accountability puzzle is the fact that just because someone's aware that someone's watching me and that someone's going to have this on a report somewhere, I'm probably going to take action upon that item a little bit faster. I don't know how many of you are familiar with the Hawthorne effect, but it just says that people who are being watched behave differently. And so the fact that Big Brother is watching and that we have the ability to report on a process and, you know, provide metrics about how, you know, a process is working, that's going to just encourage people to work a little bit faster and a little bit harder. formalizing, standardizing processes facility-wide. This is another great goal of workflow. So, oftentimes, especially in the non-clinical areas, in departments like accounts payable, finance, and human resources, a lot of the structured processes are really structured by being a form that's online. It might be a PDF file that maybe gets emailed around or gets inter-office mail around. So, it's sort of known what the process needs to be, but there's no real way to enforce it. So a lot of times, clients will look to electronic solutions to be able to build out that process, to make it electronic, to make it intelligent, and to really make sure that it's adhered to by end users, that they're pushing, a particular form or, a particular item through a defined workflow process, and that it's hitting all of the checks and balances that we need it to. And another goal is just the same one that we're trying to do on the clinical side as we're adopting technology to help us address meaningful use. Eliminate slow, manual, paper-driven processes. Paper is slow, it's inefficient, it's error-prone, and it's a pain to manage in the process, and it's a pain to manage on the back end. So, taking technologies and solutions to other areas of the department that can do the same thing, of the facility that can provide that is a huge win for an organization. So some of the challenges and barriers to adopting these workflow solutions, again, when we're talking about that best-of-breed case, many solutions are process or department specific. So even if there are unique solutions out there that can do that, going in and just picking up a single solution every time we find a paper cut or we find a slow and efficient paper process, that can lead us into the path of becoming kind of that best of breed, which can have all the drawbacks of being expensive, hard to manage, difficult to manage, having to increase our IT staff, to do all that. So that's one potential challenge and barrier. It's an iterative process. So, just as Phelps mentioned earlier, Jess was talking about how the first iteration of a process, once it gets built out, once the end users see it, it isn't always what they really thought they wanted. It doesn't mean it's not a step forward moving away from paper to the electronic process, but there's definitely another iteration that's coming. This can be because, we're not fully taking advantage of automation that's built out in the platform, whatever else. But the tools that you're working with and the tools that you're using need to be dynamic. They need to empower process owners. They need to empower your IT staff to basically have the freedom to run with it, to make changes, to make modifications, so that you can be dynamic. Because ultimately, even if there's a better way to do it, that's not going to be the only thing driving change within your organization. Processes are just going to change, and you need some kind of infrastructure that allows you to roll with that change and to quickly keep up and modify these structured processes. So if you're using solutions that don't allow you to do that, that can be a challenge and a barrier. If it's too static, if it's too rigid, if it's too difficult to make modifications to, that's a potential challenge. Choosing the right platform. So here we want to focus on things that allow us to do that. And we want to, not all the other flip side of that coin is we don't necessarily want to spend a lot of time evaluating systems. We can't have, I don't know many IT shops within healthcare that can afford to spend 6 to 9 months in an RFP process every single time someone defines a unique need for a workflow solution. So working, that's one of the big benefits of working with a single vendor that provides a lot of functionality, is that we can use that platform again and again without having to go back out to bid to look, an additional place and evaluate a lot of different solutions. That evaluation process takes time, it takes effort, and can be a burden for a lot of different shops. Lack of integration, so not having the ability to tap into your existing data. This might be your clinical system, it might be your finance system, whatever else. But again, solutions need to be able to tap into data outside their own proprietary formats. So accessing that information across the enterprise is essential to having a workflow automation platform that's going to deliver the results and address all those goals that we're seeking to hit. And then a lot of these vendors, may have a non-healthcare specific focus. So it may be you're working with vendors who deal with a lot of vertical markets outside of healthcare and may not have a specific tailored tailored solution or a deep understanding of what goes on within healthcare. So that can potentially be a challenge. You may have identified a great vendor that has a contract management solution, but their contract management solution may be totally focused on just, legal agreements for real estate. So it may not map well to what we're trying to do and the different types of agreements that we have to manage within healthcare. So there can be challenges associated with that. And then solutions that don't help enable the entire process. Where you still end up, even after implementation, you still don't have something that eliminates the paper completely. An example that always comes to mind with this is a client of ours, Doctors Renaissance, down in McAllen, Texas, that implemented Kronos, and Kronos didn't have the ability for them to send notifications to the IT staff when an employee was terminated. So, I think the story goes that the IT director was sitting in the lunchroom one day and heard that someone was no longer with the organization and, promptly got up from the table eating at the cafeteria to go turn off that person's access card, to, turn off their email, all of that. It just was, when he called up and followed up with Kronos, they said, well, if you're managing that with email today, maybe you should continue to do so. So Kronos was this enormous system that had great functionality in it, but this small piece left a hole that needed to be filled so that they could avoid situations like that in the future. So the gap workflow approach, really what it's intended to do is to kind of look at three different things: the systems, people, and processes, and kind of help them work together more cohesively. A gap workflow approach needs to be quick and easy to deploy. So it needs to be a platform that you have familiarity with. It needs to be a platform that allows you to quickly roll out solutions and that allows you to modify those solutions so that as future iterations, come out, you're able to make changes and adjust the process to provide a better overall solution for your department, for your organization. It needs to easily integrate with other applications and data. That's a big piece of that systems puzzle. We need to be able to tie into wherever that data lives. If it's in our clinical system, if it's in our ERP system, if it's in our HRIS, we want to be able to leverage all of that information to build intelligent workflow that allows us to make a lot of impact. It needs to be a familiar interface for end users. So when we start talking about rolling out things to entire employee populations, it's very, very important that it isn't some completely new solution that requires a lot of intensive training. So things that look and feel familiar to end users is going to give your organization a better chance that the adoption is going to be increased. It needs to be scalable for growth. So something that can roll out to many, many departments or enterprise-wide, but also something that's flexible enough to address not only the needs of one specific department, but provides a platform where you can build solutions for many different departments. And any type of workflow that you can think of can be built out within that tool set. Flexible as your processes change, that's very, very important. Again, it needs to be adaptive. It's going to be iterative. Your stakeholders are going to give you new requirements. Once they see what they can do, once they, spend some time with the solution that gets implemented, they're going to have recommendations. They're going to have data that leads them to see, hey, we need to rework this process. It's spending too much time here. Maybe we can eliminate that step and only send it there if XYZ criteria gets met. So we want to be able to build that automation out quickly and allow an organization to make changes to those processes. We need to have a reporting capability, having access to the data about how all of these things are working in concert, the systems, people, and processes. We want to be able to make intelligent decisions. So, being able to look at the data that's going through at a high-level process level or with the individual forms, very important. And then something that's an enterprise platform that really provides solutions for a lot of different departments. So that's what gap workflow is really all about, and how we feel that the FastFlow platform kind of can make an impact addressing those gaps. Again, it is definitely an enterprise solution, something that can play in a lot of different areas, not just the clinical side, not just the patient access department. when we're trying to admit patients, but something that is a platform that many different departments can leverage to take their forms, put them online, make them intelligent, make them routable. So, how we might integrate with an HIS such as Meditech, we can take that data and, we can interrogate it to determine, we do this all the time in patient access, where we're looking at the demographics, we're looking at the encounter-specific information, we're making intelligent decisions on what needs to be output, what needs to be generated. Do we need to electronically sign this? Does it need to be printed, to the nursing floor on two? Whatever the case may be, we can look at the data to make those intelligent decisions, and then we can push that completed output directly into the EMR. So that same concept is what we want to roll out in other areas as well. So some of those opportunities, are things like physician coding query. We've had numerous clients using our solutions integrated with their EMR and their coding solution, so that as the physicians are completing charts, if the coder has questions, we really can help bridge the gap. Because what we see right now, oftentimes, is this disconnect between the coders and the physicians, where often they're leaving, a paper note in a paper chart. And when the physician is coming in and completing other types of deficiencies, sometimes the only deficiency that's in there, or the only thing that's in that chart for them to complete, is a query from a coder about a particular DRG that they're wanting to put on a chart that they don't have sufficient information for. So we really want to help eliminate that disconnect and allow the coder to, once they identify that questionable coding, if it's on a chart in Meditech, they can basically launch an eForm that allows them to pull in all of that patient information, to pull in all of the demographic information, to also pre-fill information about that particular user into the form, so that all the user has to then do is fill in those remaining fields. So the user is going to type in their query, type in their question, and hit submit. From there, that form is going to be intelligent. We're going to know who the attending physician is. We're going to know how to route directly to that physician's inbox. They're going to receive a notification. It might be an email alert. They might be getting notified through an existing physician portal. If you're a McKesson client using physician portal or using WebStation, something like that, where it might appear with other types of electronic deficiencies. But it's instantly routed to the appropriate physician so that they can take action on it. The physician is going to see that new question. They're going to be able to respond directly on the form, type in whatever they need to say about that particular coding query, hit submit, and it's going to be routed back. Ultimately, that form can be archived, within the legal health record. So if you're using scanning and archiving or HPF or, Perceptive or Highland or something like that, we can push that coding query form associated with that patient record or associated with the encounter into the EMR, so it's accessible by the rest of the care team. So that's one simple example. Other examples are things like audit management. So coding query is kind of a simple, straightforward solution. RAC audit can be a much deeper, more engaging process, a sophisticated workflow solution that involves interaction between a lot of different departments and in a lot of different teams. So this is an example of a workflow process that we put together for Dr. Renaissance in McAllen, Texas. They're a 600-bed physician-owned facility that was just a magnet for RAC audit requests. So RAC audit happened to be, a very revenue-sensitive, time-critical process where as soon as that letter from, the auditor came in, we needed to trigger and engage a lot of different departments at the same time to take action and enter data and supply the appropriate supporting documentation so that we can respond effectively. One of the other things that's really important about this overall process is you may be getting hit with so many of these things that you can't respond to all of them. So having visibility to all that data helps you allocate resources to focus on the ones that are, have the largest dollar amount or have the least amount of time to reply. So a lot of different things like that enable you to be more effective and to respond, faster. Other opportunities, for compliance, incident reporting is one that we commonly talk about with our clients. So an incident happens, it needs to be documented. It needs to be documented quickly. So a big part of that is having a user interface that's very, very acceptable. to users, something that they're familiar with, something maybe even that looks like the same paper form that they've been filling out for years and years. But once that information is collected, we want to make sure it gets routed to the appropriate people. So if it has something to do with a drug, maybe we need to notify not only the VP of Quality but also someone in the pharmacy department, we could do that. If it needs to be routed to someone in nursing or someone in facilities or whatever else, we can look at information that's collected in the form or the type of form itself to route it to the appropriate person to make sure that it's handled correctly, that the appropriate people are notified. But we can look at the data to determine where that needs to go. The workflow and analytics, reporting and analytics, very, very important so that we're not just routing and notifying, but we're looking at this process in aggregate. And we're able to look at all of the data about how many, falls did we have in the ED in a certain time period. What did we do to impact change between, Q1 of 2012 and Q1 of 2013 to reduce that. So we have the data about what's going on when we're filling these forms out. It's not just a paper form that's going to end up on a spreadsheet somewhere that someone else has to maintain. Just by virtue of it getting pushed through a workflow engine, we're capturing data about the process, but we also can aggregate the data that's being collected in that form so that we can provide that data and make that available to department heads and people who can look at it. So those process owners can view that information and make intelligent decisions on how to move forward, what we need to address, where we need to focus attention. Billing rejection workflow, this is another great example of a potential process that's revenue sensitive that doesn't necessarily have a point solution available for it. So when you're submitting claims to payers, when you're submitting claims to insurance companies, a lot of times that might get rejected. And so when that reimbursement is denied, someone needs to be notified to take action to provide whatever documentation is needed to basically justify the claim. So what's going to happen there is basically someone's getting notified in Patient Financial Services, and you can start a process to engage various departments, health information, to engage people in the coding department. Whoever else who needs to be notified can get queried to provide additional supporting information so that we can respond to that request, so that we can send that information back to the payer, and so we can collect the revenue that we think we're due based on the care that we provided. And having an electronic process that allows you to manage all of that information enables you to do that very quickly. And then finally, some of the non-care related, that's more on the back office side of the house, staff evaluation. Performance evals are notoriously a painful process for various organizations, so moving to something that's electronic can really speed things up. But again, HR information gets collected in an eForm where it can get routed to someone in HR, to the employees themselves to fill out. That form can then be looked at or routed back to the manager so the manager can meet with the employee and they can reconcile differences, conduct a meeting, go through the process. And then once it's complete, we may want to archive that in some sort of employee record. So, if you're using a solution that you already have your solution online, we can store it there. If not, FastFlow has a content management module that allows us to store that completed HR event and any other employee-related information in a fully indexed, searchable record for that employee. So the human resources workflow can be very, very beneficial, not just limited to staff evaluations, things like job requisitions, things like time and expense and other payroll type workflow. Those can be built out as well. As we continue moving around the hospital to the finance department, purchase request is another common one that we're hit with to provide a solution. So it's a very, very simple process for anyone who's ever had to purchase anything for their hospital. They identify a need, they need to fill out a request, they ultimately route it to the manager. Maybe the manager has to make a decision on it. We want to help do things like automate that decision, automate sending it from me to my manager so that it gets where it needs to go quickly, and still have a framework where I can view whatever document that I push through. So this purchase requisition process, you know, in paper, a lot of times it's going around. It may get stuck on the manager's desk, buried underneath a lot of other higher priority items, and as a submitting user, I have no visibility to that. The accounting department has no visibility to in-flight purchase requests. So they might not be aware of items that might be getting purchased in the next, you know, 14 to 30 days, something like that. So increasing that visibility can be an important driver behind this process, in addition to just the efficiencies that you gain. So the key workflow features that we're really looking for is, you know, a solution that can come in and provide a lot of value for various departments within an organization. Some of the unique differentiators for the FormFast workflow solution is that we can allow you to use tools that you're already familiar with, such as the same form designer that, you know, many of you use for your clinical forms today. We can schedule tasks so that these things can be automatically delivered, and we can have notifications that alert users to take action upon a form. So if we need to automatically start a workflow, that's not a problem. If we need to automatically alert someone that they need to take action upon a particular item, that's not a problem. You know, a rules-based workflow engine really enables you to take that standardized process and build it out in an electronic environment so that as items go through that process, they're intelligently routed where they need to go next. So we could have a step in a workflow that says route to my manager, or we could have a step in the workflow that says look at the dollar amount on this form, and if it's over a certain amount, go get the CFO's signature, you know, approval that we can pay this or we can process this. So that's very, very important. A wizard-based or visual workflow creation tool is important to empower your IT staff, to empower your department heads, and give them the ability to make modifications, to make changes. You know, this isn't going to work if it's too difficult for departments to use. So making that very, very easy to use is essential, and finding a platform that lets you do that is crucial. Integrating with those data sources, so, you know, things like your Meditech DR environment, your Paragon database. We want to be able to tap into those to leverage your clinical data, information about your patients. We want to be able to tap into Active Directory to use, you know, your employee and your organizational information and their passwords so that they can log in and get authenticated quickly and easily. So a lot of different databases. Finally, we want to be open ourselves. So, you know, we want to have you able to point, you know, reporting tools and have you point your systems at our solution to leverage this data, to look at this data, you know, beyond just the tools that we provide. So to be able to call us from third-party systems, to be able to initiate workflow, you know, from SharePoint or from other tools that you may be using, having an open architecture in your workflow platform, very, very important. So any questions about the features, the functionality, or GAP workflow as a whole?
All right, like Jordan said, we're going to open it up for questions now. Thanks to Jordan for the great presentation there. Jordan, one question that comes to my mind is you mentioned several applications there. Is there a common thread or a certain area of the hospital that you feel like is the best place to start to investigate where those GAP workflows are?
Yeah, typically the gaps aren't very hard to find. Identifying which ones you want to tackle first is usually a harder thing for an organization to do. I mean, there's just so many paper-based processes that are still latent out there. I had one client describe it to me as, you know, death by 1,000 paper cuts. So I thought that was a pretty good model because none of them on their own were really essential processes, which is why they still exist as paper processes today. It was just things that, you know, we're kind of going to deal with. We're not going to go spend a whole bunch of money for this just one solution that addresses this one need. So, you know, it's really kind of a function of rallying all of these little pain points together to say, hey, we want to address not one of these, but all of these, and then figuring out which ones that you want to start with. And so typically when we work with clients to build that business case and to talk about why the justification for why we're going to do this and how we're going to do it, we try to identify a couple simple ones, a medium one, and then a much more complex one. So that does a couple things. One, that allows us to hit the ground running and get a quick win with a simple process. So this might be something that my clients sometimes call a one-and-done workflow, where we fill it out and we hit submit and it gets routed to someone who processes it and then it goes into storage. And that's kind of one and done. So some examples of that might be things like time off requests, things like a lot of HR forms that get routed to a generalist who's going to process, make a change, a name change form, a leave of absence request form, things of that nature, where it might need to go to a manager for approval and then it's going to go into HR for processing and storage. So those are pretty good candidates for the first thing to tackle, or the first thing to tackle as part of an overall larger implementation. From there, adding in some more sophistication, maybe looking at things that might have multiple levels of approval. So things like purchase requisition, invoice automation, those come to mind, where we might be looking at data that's in the form to determine where it needs to go to next, potentially going to get multiple levels of approval in the process before being routed back to someone who's ultimately going to handle that and make that change and do whatever they need to do. And then finally, other more sophisticated solutions like the financial services billing rejection workflow. That's an example of a solution that can be, have a lot of ins and outs, a lot of different people participating in the process, and then have a lot of data that needs to be presented to various stakeholders. So the dashboards and the reports that go along with it are just as important, if not even more important, than the actual automation of the process itself. So typically having all of those in a larger implementation is an approach that seems to work well for many organizations we work with.
Great. And if you'd like to meet with Jordan to kind of walk through that process and do a bit of discovery about where some of those gaps are, we'd love to send them your way. You can reach out to us at formfast.com/contact and request some information or demonstration, and we'll put you in touch with Jordan to talk through where some of those inefficiencies are that we can help you overcome. Jordan, looks like we're done for questions unless there's any last-minute questions that come in. So I'd like to thank you for your time, and I know that you're busy, so appreciate you being here.
Absolutely. Thanks, Aaron.
Okay, we're going to move to our virtual breakout session in just a moment, but we got a request via chat for me to speak to some of the ways that we're working to improve customer service. And I don't have a slide for this, but I feel like it's important to speak to, especially since we got a request for it. It's good to note that with our current process, we've implemented surveys that you may have received after contacting the help desk. We do look at those and take those very seriously, so we ask you to fill those out at the completion of a case, because we do use that information to improve our customer service. Like Rob said yesterday in his keynote address, just the same way that we're encouraging you to improve processes, we're always looking for ways we can improve our own processes as well. So that's one way in particular that we're working to improve customer service. We've also implemented the new user group site that I spoke to yesterday to give you more resources, more tools, those training videos, the documentation to help you get more plugged into the software and answer the questions that you might have. We also offer a variety of training options. It's very important to us that you feel comfortable with the software, that you have an understanding of what we can offer with our solutions. So we offer multiple training options for that, including on-site training and online training. Once again, if you reach out to us at formfast.com, FormFast.com/contact, we can tell you more about some of those training options. And finally, as Rob mentioned, we're investing more in account management resources so that you have someone to talk to about issues that you might be experiencing to help move you along and help hedge some of those concerns. You might be hearing from those account managers soon if you haven't already. So there's just some of the ways I feel like are important to call out as we improve our customer service programs. So this time we're going to move to the virtual breakout session portion. Once again, if you missed yesterday's meeting, you'll be presented with a selection screen to choose which breakout session you'd like to attend. Today you have 4 options to choose from. We have a session focused on Form Designer, and as I mentioned earlier, the consultant who's leading that is going to be talking about foreign language forms, especially Spanish forms. So if you're having issues with that, definitely encourage you to check out that session. We also have another session around fast print, web form imprint, and e-signature. So if you are interested in those products, join that session. Form Central for our Meditech Magic users, and finally FastFlow for those using our workflow automation platform. A couple other things before we break. Over the course of the 2-day event, we've shown you some new products and features that have hopefully inspired you to do more with FormFast products. If you'd like to see more of the new solutions that we've shown, or would simply like to discuss upgrading, reach out to us at formfast.com/contact. Request a demo by clicking the Request Demo icon. But before we move to the breakout session, I'd like to announce the winner of today's iPad mini drawing. From those that registered for today's session, the winner of the drawing is Lene Walker-Sanders from Children's Medical Center in Dallas. So congratulations to Lene. We greatly appreciate you taking time to join us for the past couple of days, and we hope that you found the information to be interesting and valuable. We also wanted to thank you for your business. It's always, your feedback on ways we can improve is important, so don't hesitate to reach out to us. One way you can get in touch is sending me feedback directly to avod@formfast.com, as you see there on your screen. Thank you once again for your attendance, and enjoy the breakout sessions.